Hello, my name is Dr. Cheryl Burdette, and I am the Educational Director for Origins Incubator. And today, one of our case studies involved a patient who has done quite well. She was suffering from Lyme, and walking her through a functional medicine approach, seeing her Horowitz score come down quite nicely, her joint pain resolved, her major complaints all moving towards remission, really that thing that we're looking for. However, some symptoms that were outliers were that even though she was having great improvement, antibodies to her thyroid were still staying elevated, as was her cholesterol. So the question of the clinician was, why hasn't this shifted, even though her underlying issues have shifted? And so I think that this is just something that we certainly all see, and it's this unraveling of the onion, peeling back those layers. And the beauty of this case is her core chief complaints have improved. And so now we're able to kind of get rid of these other areas of support and move to these more specific, more nuanced pieces of her puzzle. But this is exactly the way that a case should be approached. And this is what we do in community, in our office hours, when we come together and we discuss these case studies. So we look at, where do you start with somebody who's very complicated, who's experiencing a lot of pain, a horrible decrease in quality of life? You probably don't just start with, well, there's an elevated antibody to your thyroid. Again, this can be part of it, but how do we peel back the layers of the onion? And so this clinician has very successfully done that, and now getting to that phase where we focus more on that little nitty gritty, cleaning up those last details. So one of the things that we noted in our case review together was that not only did she still have elevated antibodies, but she also had elevated cholesterol. And this fits together in that thyroid is one of the major ways that we metabolize cholesterol downstream as the backbone for other steroid hormones. So again, rather than saying we've got to treat this, we've got to treat this, we've got to treat like the line by line, understanding the interconnections of the patient and realizing that we can work on the thyroid piece next, and that should help us see a decrease in the cholesterol. So in terms of an antibody response, we back it up and we think about, okay, what are our big foundational functional type of a picture here? And we know that when there are antibodies, that this is an autoimmune condition. So that gets us back to some of our foundational piece, which is to think about the gut and to think about what's going on in terms of irritation to the gut. This patient had already done a lot of work with stool testing and had done better there. So if it's not a bug in the gut anymore, then it's likely a food. So she moved to looking at foods this patient is sensitive to. The patient will now go through a phase where she gets rid of these foods. And we know that the research says this is associated with a decrease in antibodies as well. So we'll continue with that foundational principle of treat the gut, because we know that this is a hallmark of autoimmunity. And we'll also continue to drill down in terms of what's happening in the thyroid when there's more of an antibody response. So it turns out when there's more of an antibody response, in addition to our big picture, what's happening on a gut level, we will think about what's happening in the tissue to cause this to occur. And so when there is an increase in reactive oxygen species created here in the thyroid, they rip up thyroxine, they rip up thyroid hormone, so it looks odd. When it looks odd, when epitopes are exposed, we start to produce more antibodies that attack the thyroid. So we say, in addition to our good gut-based principles, how about locally, how do we make the tissue healthier? And we know that ways to do that are to increase the local antioxidant system, which happens to be glutathione peroxidase. So now we can utilize all of our glutathione strategies. In this case, something as simple as selenium may well be just the next thing that she needs. For example, 400 micrograms of selenium will increase the activity of glutathione peroxidase, the major intercellular antioxidant system of the thyroid. But in addition to that, And there are 11 selenium-proteins in the thyroid. So getting that selenium up is really useful to the tissue. So yes, we need to think about big picture, and our foundational piece, that's the gut, because it's not an immune condition and they're in antibodies. But in addition to that, we'll think about locally what makes the tissue healthier. And selenium's a great go-to in terms of thyroid function for antibodies that are being produced. Now, as we get that corrected, it means that the thyroid should adequately metabolize cholesterol. And so again, rather than having to layer treatment after treatment for the line by line, when we're able to look at these interconnections, we're able to treat the whole person, work towards root cause, keep pulling back those layers of the onion until we get the patient to a space of ultimate wellness.